Thank you, Nupur ma'am. Very good afternoon, everybody. I'm Dr. Sunandini. So, at the onset, I would like to thank Team YOSI AIS APAO for giving me this opportunity. And I would be sharing my experiences about the reality check that you need to be prepared for your options while moving on. So, as you finish your residency, you have given your exams. Now, the next 20, 30 years, you have a long career. So, it is very important to choose the right path because this is something that you are going to enjoy or hate for the rest of your life. So the various paths that are either clinical ophthalmology, or you can also go for something as non-clinical or non-ophthalmology also. You can give exams after you finish your residency for diploma holders and MS holders both. You can give DNB, ICO exam, FRCS exam, FRC of exam. This will add to your clinical and surgical skills. They will also give you that extra boost to your CV. They will also give you that feather, add the feather to your cap. So what options do we have are the fellowship, the SRship, private practice, government jobs, institutional jobs, and corporate jobs. Fellowship can be either long term and short term, or the international fellowships. So it is very important to choose the right kind of fellowship, because this will, you have to understand that how much work that you want to learn, and what is the uh, time duration that you want to give, right? Also the branch is very important. So talking about the branch, so the first one is a comprehensive ophthalmology. This is the most widely chosen branch. So it fills up the deficit in your previous training programs. Clinical research and surgical exposure is more in this. This form the basis of the next specialty fellowship, or it can be a short term fellowship also. And it gives you various opportunity to write the other exams while you are doing a comprehensive ophthalmology fellowship. Coming to the cataract, cornea, and refractive, it is a very high grossing if you're doing a refractive. Cornea, if you're doing a private practice, it is has to set up something in a peripheral setup so that you can get keratoplasty cases. Glaucoma is a very good option. It has a very moderate investment. You can do a private job, corporate, or institutional job in this. Coming to retina and uvea, it is a very investment heavy, but it's a very satisfying job if you know how to do your job well. Also, any kind of city or any kind of metro you can practice. Then is the oculoplasty. It is a very good option. It does not have any investment. You can do a freelancing work or work in a private practice together. Ocular oncology is basically an institutional job. Pediatric ophthalmology, I would say that, in my opinion, 3 years might not suffice, and institutional job and corporate jobs are better in this. So there are various international fellowships that you can opt depending upon what kind of country that you want to do. ICO fellowships are the widely spread international fellowships nowadays. So SRship gives the extra qualification of applying for a job in India. It sets up you well for your private practice because you get a lot of hands-on, and you can also pursue a short-term or long-term fellowship after this. Uh, Coming to the private practice, so you need to have a clear goal. You need to set up that what kind of place you want to work, whether it is a small city or a big city, and you need to keep your finances on check, because basic OPT setups can be from 8 to 15 lakh rupees, and a basic OT setup will cost you at least 20 to 30 lakh rupees. You can also join a senior consultant in your first years, so that it gives you time to adjust. You get a support cushion, and also you learn the trips and tricks of the private practice. Also, you get to learn about the contacts, the various ophthalmologists, and the trade people, so that it helps you in your own private practice. You can also do some collaborative setups like a lot of people do now in metro cities. So you can have 2 to 3 ophthalmologists with you. So there is a division of labor and stress, but definitely there is division of finances also. Government setups, I think this is one of the best options, because if you have some interest in teaching and academics, it is a very good place to do. Job security is maximum in a government job. You have a very good growth in this, and it is a very set kind of practice that you can do till the end of your life also. Institutional jobs are very heavy workload, so you get to learn a very like different type of cases, and you have a lot of hands on. You get a lot of recognition. There are a lot of academics and teaching if they have fellowship and ENBs also. Corporate jobs are good if you want a limited hours of working of 9 to 5 or 10 to 6. Some people also give part-time jobs in corporates also. Support cushion is there. You get a recognition. You get used to uh, you get to use various investment heavy devices such as ICG or something like that. But it will not be your name only in a corporate. That you always have to understand. It is going to be their name, and very few people in corporate are in that level where people are knowing you. So we do have a fellowship help desk in Yosi if you ever need some help. This is Dr. Ritu's lead. And we have a Yosi career portal which is led by us where we post fellowship and job portals. So what other options then other than clinical ophthalmology do we have? So the first is you can found up a company. It can be a small company or a multi-tier company, but you need to have some risk, some learning and mastering the business of startup, right? Then you can partner with the industrial partners such as the pharmaceutical company who helps who take your help in the clinical trial, drug development. You can have somebody from a medical device company who need you for product designing, testing, and marketing, and healthcare startups such as in strategic planning and market analysis. Then, as I talk about product development, various kinds are the new drugs, devices, diagnosis, and services. Research and development as an advisor, if you want to do a part-time job, that is also okay. Developing and marketing innovative ophthalmology product, which is very in nowadays in India is there. Digital health, that is a AI-powered diagnostic tool or subscription-based revenue, or you can create your own apps on softwares for vision health. Eye care administrators are basically ophthalmologists who have a wide variety of degrees in MBAs, and they join these corporate hospitals or big institutes as a healthcare administrator, financial management, strategic planning, and business operations. So this is a leadership role. They can also get themselves involved in the clinical trials or advisory boards and consulting. So I do a NGO work, which is a 365 days work with my team, where we conduct, routine checkups for them. So this is also something that you can do. Healthcare policies and regulations, you can be at the level of a politician where you can change the, policies of a healthcare. Uh, and the last but not the least are the legal consulting team, where you provide expert testimony for legal proceedings, legal consulting, so that if a firm wants a ophthalmology related legal issue, you can help in that. And also assessing the validity of insurance claim related to eye care. So obviously you have a wide range of career option that you can choose from, but just choose something that you are very passionate about and you like to do it, because this is something that you're going to do for the rest of your life. Thank you.
Okay, so Dr. Sunandini, very nice talk. You've covered all the parts of how to go for government, corporates. So now we have options of other things also that we are talking about, expert panels and legal teams and all. Any comments on that? What should be done for somebody if you want to join it? Just after fellowship, is it advisable for them to go for it, or after MBAs or something else they want
No,
to?
you don't need for any legal consultancy work, you don't need any MBA degrees. You can even join after your routine residency, but they do want an experience of at least 3 to 4 years in after residency in most of the firms. But you don't need an MBA degree for this. For eye care administrator, you need an MBA degree.
Yeah. So that's really nice to know, because now we have other options as well. Earlier we used to have only fixed idea, like you have to join some hospitals, you have to start your private practice. Now we have a lot of other options as well. You can have visiting hours in some hospitals and work at your own setup. So it's a mix and match of all the things. So it's like a hybrid thing that we all doing. So it's really nice to see you presenting this way, giving all the pros and cons. Thank you for that.